What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering how often do you have to repeat images due to your rad not being happy to you. Radiologist, for those who do not know. So to give you context, I'm an Xray tech. I do night shift at the hospital. I work 7 on, 7 off. I do a lot of overtime, so I do dabble in the day shift. So, to give you context, majority of the times when you have to repeat it, well, we'll talk about night shift and then versus day shift, okay? So during night shift, the majority of the times you'll rarely hear from the radiologist. It'll always be like the rad's report will get, like on the report, it'll say, oh, due to possible fracture, repeat the lateral, whatever. Or due to possible pneumonia, have patient more this way. Or like possible fluids in lungs, make sure patient's fully erect, But majority of the time, they won't contact us unless, like, the actual radiologist won't, unless, like, we messed up, like, pretty severe. Then it will be that. But usually it just, the report shows up and, like, the ER doctor will just reach out to us and be like, hey, the radiologist wants another view for this, and then we'll just go do it. It's not really bad. They just put another order and we'll just do it like that. But most of the time it'll be more because he'll, like, let's say ankle was broken, right? You shoot it, and like there's a crack that he sees that could, like, continues up or looks pretty big, that he thinks maybe it goes up the tip fib, and then occasionally they'll reach out to the ER and they'll tell them to put an order for a tip fib for, possible, like, fracture to continue up there. That's when we'll have to, well, that was not really repeating, that's more of a continuing to evaluate the patient, which ain't that bad. I mean, that's mainly what will happen. Occasionally our doctors, the ER doctors, will request us to repeat exams if maybe they're not as happy with the images, maybe, or they suspect, like, the patient's getting better or getting worse, then we'll have to repeat for the ER the ER, like, physicians and stuff. During the daytime, it's different, because during the daytime you have your rate. Well, depending on where you work and how big your place, ours has the radiologist in-house. So they'll call you up from within the department and be like, yo, Miguel, I'm gonna need you to reshoot that lateral. It looks not good. And depending on who, like, you may get roasted. Depending on the relationship you have with it, you may get roasted. Like, yo, this look like, could do it again. Like, I ain't never been disrespected. Occasionally, there's been techs that have gotten pretty bad disrespect, but they kind of already get along with the radiologist, so it's like more of a joke. It's not really them being mean or anything like that. And it's usually just, straight to business. Be like, hey, reshoot 23, Hey, we need And it's like that. It's not nothing crazy, but that's really about it. Majority of the times, shoot it, keep it pushing on to the next one. And yeah, it's been your boy Miguel. See you on the next one.